Hey everybody, welcome back to our Ethiopia Rises, where I interview different Ethiopian individuals about their job experiences, life experiences, different perspectives, cultures, etc. And today I have Dr.Melaku, and he works at Washington Medical Center as an internist, and he's worked here for a long time, and I'm just very glad to have you with me.
Okay.
To start this interview off, can you just please introduce yourself and explain what an internist does? Because I feel like a lot of people know or have heard about what an internist is, but they don't really know what they do.
Okay. Thank you for having me. I'm Dr. Melaku. I'm an internist by profession, and when I try to explain what internists do after having of a graduation from a general practitioner, there is a different disciplines of specialization, and one of the specialization is internal medicine. So when you join and train in internal medicine, you dealt with most of the internal medical problems. So it dealt with most of the internal problems going on in our body, and after you complete this training, you became an internist.
Okay. Well, what do you think inspired you to specifically pick internal medicine other than the other specialties?
I had an interest to deal with most of the disease. Initially, after I became a GP, there is a dilemma to become a gynecologist, pediatrician, surgeon, internal medicine, or other disciplines. But when you see internal medicine, it touches every systems and every specialty disciplines. Like it dealt with a renal problem, it dealt with a cardiac problem, it dealt with a hematologic problem. So it's a broader way of knowing our internal body, and most of the disease will be dealt by internal medicine. So to be a hospitalist, to deal with many diseases, it's better to be an internal medicine. That's why I prefer to be an internal medicine specialist. To add on this, while I was a general practitioner, I was good enough and interested to become a gynecologist. But after I just saw it, and internal medicine is an interesting field to proceed with a further subspecialty fellowship. That's why I choose to be an internal medicine trainee, and I became an internist.
Okay, that's a very interesting journey.
Thank you.
I feel like you've been working at Washington Medical Center for a long period of time. What are some of the big changes you've seen in healthcare in Ethiopia?
It's changing beyond our imagination. In the past 5 years, in the past 10 years, things has been changing every year. Starting from the documentation, the way we document most of the medical record has been with paper, but in the past 5-10 years, it's changed. It became more of electronic-based documentations, and most of the equipment that we are using currently to make a diagnosis is becoming more advanced, and with the support of even artificial intelligence, if there is any dilemma in terms of making of a diagnosis, treating a patient, there is an immense support from the AIs. So year by year, we are seeing a significant change in terms of medicine.
Okay, that's very interesting. Okay, my question is for you is, as an internist, you see different patients with different many conditions. What is the most prominent or most common in adults today, and how can we prevent it?
Pardon, please.
Like, you, as an internist, you see many different adults with different conditions. What's the most common condition that people are coming to you, getting checked up, and how can we prevent it?
Most of the problem, we have to divide it in, system by system. Most of the individuals that we saw have a gastrointestinal problem. Some individual might have non-communicable disease, and some individual might have communicable and infectious disease. So considering of our disease pattern and flow of patients to every center, not only to Washington Medical Center alone, most of the disease that we saw, either they are communicable or non-communicable disease. So if we take communicable disease, since it's very common to be in Africa in tropics, we have to adopt the preventive methods for every infectious disease, like the simple one, washing hands, and if there is any infectious process that's going to be transmitted by aerosol mode of transmission, like wearing of mask, keeping of social distance. These are the way that we can apply it in everywhere, not only in a hospital setup, but at the community levels. This is in terms of infectious disease, and we are seeing many cases because of infection. You can see patient with pneumonia, flu, patient with tuberculosis. So it's related with infection, so it can be prevented by using of the preventive methods. But nowadays, because of the development and because of the economical change happening in the country, not only in the country but also as a globe. We are seeing many cases because of non-communicable disease. Like you can't imagine how many patients are developing of DM, hypertension, cholesterol problem. So this problem, while we were a student in undergraduate, we are not seeing that much. A very high number of individuals they didn't have this problem. But nowadays we are seeing many cases because of DM, because of hypertension, because of cholesterol problem. So this non-communicable disease, they create an immense burden to the health system at the country level. So we have to have at least a preventive method for non-communicable disease. So people should select what to eat and how much to eat, one thing, because this is a determinant factor for the development of the metabolic syndrome that I said it before. So if they select and if they limit the amount they are taking, that is one of the preventive methods. So the other thing is doing of regular physical exercise. We are using car for a means of transport, and most of the individual they differ from having of any physical exercise. So in the old days, most of the individual they didn't have the chance to go by car. So nowadays people are using car and some other means of transport to go even a very short distance. So they should have at least regular, either passively or actively, they should have regular physical exercise. This is the second method to prevent the non-communicable disease. And the third one is at least early screening. Most of the individuals, they don't have any habit of having of annual checkup. So if they have the habit of having of annual checkup, and if the problem is picked at the early stage or before the development of any complications, that's one of the preventive methods, not only in making of a diagnosis, but in preventing of the complication that's going to happen because of the non-communicable disease. So this is what we saw in our clinic most of the time, either communicable or non-communicable disease.
Okay, thank you. I think that's very excellent advice for people watching. Finally, for any student that look up to doctors or they would like to pursue medicine in the future, as a physician, what's the one advice that you would give to these young people?
Being a doctor and being to enroll in a training of medical school, first, the individual should have the interest. So top on the list, they should have the interest to be a doctor and to be a physician, and they should have also an interest to help individuals, irrespective of who they are, what they have, and from which background they came. So if they have this interest, it's very easy to join medical school. Then after they join in medical school, they should have the endurance to complete throughout the course of the medical education, because medical education by itself, it has many burdens. I mean, the training is very long, you have to study day and night, and after completing of the first degree as a general practitioner, things will not end at that stage, so you have to continue for residentship, and from residentship for fellowship. So they should have the interest to go through this whole challenge. If they have this interest, it's very interesting to be enrolled in a medical school and to be a physician.
Okay, thank you. I'm just very glad for your time. Thank you for sharing your opinions and your experiences with my YouTube channel. And I'm hoping anybody that can see this can look at this video and use the advice given by Dr. Melaku.